Hi guys, welcome to Pharmacy Made Easy. In today's video, we dive into the fascinating world of pharmacology. Pharmacology is a Greek word. Pharmakon means the drug or a science, and the logos mean the study or a science. Meaning, in simple terms, it's a study of drugs. The pharmacology, it's a vast field that includes various branches. Let's take a quick tour of the main branches of pharmacology. And the first one is Pharmacokinetics. This is what the body does to the drug when it is administered into the body, like how it is absorbed, how it is distributed, how it is metabolized, and how it is excreted. Coming to the next branch, that is Pharmacodynamics, it is nothing but, in simple words, what drug does to the body, like mechanism of action and its effects. Coming to the next one, the branch is Pharmacotherapeutics. It studies mainly the use of drugs to treat the diseases effectively. Coming to the chemotherapy, which means the drug that destroys an infection or a cancer cells. Coming to the next branch, that is toxicology. It's a study of harmful effects of drugs and chemicals. Coming to the pharmacovigilance, it's like monitoring the drug safety and adverse reactions. Coming to the next branch, that is Pharmacognosy, the study of drugs from the natural sources like plants. And coming to the clinical pharmacy, that is a patient care and the medication management in practice. Coming to the next branch, that is a pharmaceutical chemistry, which includes a drug design, synthesis, and the chemical properties. Last but not the least, coming to the biopharmaceutics, it deals with how drug formulation affects the absorption and its action. Before we go deeper into the branches of pharmacology, let's look at how drugs are administered into the body. Drug administration routes are broadly categorized into local and the systemic routes. Now, let's explore the local routes of drug administration, where drugs are applied directly to the site of action. The first one under the local routes is the topical routes. Here, the drugs are applied to the skin or mucous membranes like creams or ointments. This route offers a minimum systematic side effects, as the drug mostly stays where it's needed. The absorption depends upon the skin thickness. The thinner the skin, the higher the absorption. And coming to the second type under the local routes of drug administration is an intra-articular routes. Here, the drugs are injected directly into the joints. It allows targeted delivery to the affected area, ideally for the joint conditions like arthritis. Third type under the local routes is intrathecal route. This involves injecting the drug into the spinal canal, reaching the central nervous system. It is especially useful when we need to bypass the blood-brain barrier. Understanding these routes helps to choose the right method of local drug delivery. Now, let's explore the systemic routes, where the drug enters into the bloodstream and travels throughout the body for the whole body effect. Under this, first one is an oral route. Here, the drugs are swallowed in the form of tablets or capsules. The oral route, it is a most convenient, economical and safe, but some drugs are broken down in the liver before reaching the bloodstream. This is called the first pass metabolism. Example are aspirin and the paracetamol. Coming to the second one, under the systemic routes, is sublingual route. Here, the drug is placed under the tongue. It gets absorbed quickly and avoids the first pass metabolism. However, it is not suitable for the bitter or unpleasant tasting drugs. Example, nitroglycerin for angina. Coming to the third one is under this systemic route is the rectal route. The drugs are given as an suppositories or enemas. It bypasses about 50% of the liver metabolism, and it is useful if orally intake isn't possible. The absorption can be irregular and it may cause a discomfort. Example, diazepam, especially for the febrile seizures in children. And the fourth route is transdermal route. These drugs are absorbed through the patches on the skin. They offer a slow, steady release and longer lasting effects. Only suitable for a highly lipid-soluble drugs, example, nicotine patches and fentanyl. Coming to the next one is inhalation routes. The drugs are breathed in through the gases or the aerosols. The absorbed drug rapidly in the lungs with controlled dosing. Requires proper inhalation techniques. Example, salbutamol for asthma, nitrous oxide in anesthesia. And the other route for the system under the systemic is nasal routes. The drugs are sprayed or dropped into the nostrils. They offer the fast absorption and skip the first pass metabolism. Can causes the nasal irritation. Examples include despressin for the diabetes insipidus. Now let's look at parenteral routes, the injectable ones. Under the parenteral routes, the first one is the intravenous. Under the intravenous, the drugs are injected directly into the vein. This gives 100% of bioavailability with immediate effect. This helps great in the emergencies, but it needs skill and has a risk of infection or embolism. For example, morphine for emergency pain relief. And the second one is under the parenteral routes are intramuscular, IM. These are injected into the muscles like the deltoid or a gluteal muscle. These are suitable for the oily or a less soluble drugs. They can be painful and may cause nerve damage. Example are streptomycin and antibiotic. The next to another injectable is subcutaneous. Under this route, the drugs are injected under the skin. Slower absorption and can be self-administered. Not ideal for the large volumes. Example, insulin for diabetes. Coming to the next injectable, that is intradermal. Under this, the drug is injected just into the skin layer at the shallow angle. Used for testing and vaccines. Can only hold very small volumes. Example, BCG vaccine and allergy tests. Choosing the right route depends upon the drug, the condition, and the patient. Understanding each method helps us use of medicines more safely and effectively. Stay healthy, stay cheesy with Pharmacy Made Easy. Follow for more.